If you missed it last fall in Washington, D.C., I spoke on the evolving payment models that we face in the billing industry. Over the last several years, our typical client model has changed. We have seen an evolving client model due to several circumstances in the industry. We've seen the adoption of electronic health record systems. And in our typical client model, where we used our software to manage their receivables, we're now having opportunities and requirements for us to use our clients' EMR products to do the practice management, billing, revenue cycle management. We have had other issues that have made change in evolving markets. We have had government involvement in the payer system, looking at bundled billing, looking at accountable care organization, a lot of different models that will change the manner in which our clients are paid for the services that they provide. And we have also just seen in general across the country some acquisitions of physician practices by hospitals. So our evolving client market is no longer just the typical model that we've had, but an evolving group where we have to start looking at different opportunities. Now, some would call these threats. Some would see the increased capacities of electronic health record systems as a threat to our industry. Some would see the acquisition of provider practices by hospitals as a threat to our industry. Is that a legitimate claim? Yes, certainly there can be threats, but with the biggest threats come opportunities. So we have to look at our models of how we're going to market and reach clients. Are there still the same number of practices that we had in the past? Most likely, but they're not all independently owned any longer. Some are owned by hospitals. Does that mean we quit marketing to those? Absolutely not. We have seen over many years, as hospitals acquire physician practices, while they may have a good understanding of managing the receivables on their hospital inpatient Part A, they don't understand the physician billing world. We do. We're the best at that. HBMA members have a long history of successful billing for physician office practices. Now that they've been acquired by hospitals, the hospitals may need our assistance. So we urge people to consider using HBMA experiences, resources, and market to hospitals. Show the hospitals what you can do that they struggle with. So these practices are still there. They're under hospitals. So include hospital organizations, hospitals, and their related industries in your marketing plans. Consider working with other industry associations. Perhaps can partner with HFMA, with rural health associations in your local state, American hospital associations. Be a presenter at their conferences. They've acquired these practices. They have a lot of speakers that will talk about hospital issues, but they have a growing audience at their conferences who need to hear about the physician practice management. Offer to be a speaker. Get your name, your company name out there in those venues so that when they need resources and information, you become the go-to resource for them. So that audience is still out there. They just look a little bit different to us today. Back to the EHR systems. Are they taking our business? Are they hurting our situation? Are they a threat to us? Again, perhaps. But look at working with them. So a client has acquired an EHR system. Does that mean we're completely out of the picture? No. It means an opportunity where we can perhaps use that electronic health record system. They still have the same situations they've had in the past. They have software, but they don't have the people. They don't have the training for their staff. They have turnover. We can come in and as a user of a given software, if we have 3 or 4 that we've identified, these will be the EHR systems that we're going to use, then we can reach out to the market and say, hey, all of the users of XYZ EHR system, we understand that system well, we're knowledgeable with that system, we can provide the revenue cycle management. You do the clinical inputs on your side, we'll take care of the receivables management with that system. So again, these threats do survive, they do continue to grow, but we don't have to take them as threats. We can convert those to challenges, to opportunities, to potential growth for us using HBMA resources, using our knowledge of the industry, and good luck with that. That can have a good future for you. Thank you.